Okay, 33 weeks. So what do we see here? We see but the situs is normal. We see two chambers. Uh, the the one on the left is the right chamber. The one on the right is the left chamber. And now let's move to the outflow tracts. And we see there that there is a big vessel coming out of the right chamber and a smaller one coming out of the left. And especially if we look at there where the two vessels come close to each other, where they uh, join, there is a clear discrepancy in size of the aorta compared to the pulmonary artery. We see also the IVC below. So, is it normal or abnormal? I would say it is abnormal. And in my opinion, this is a case of coarctation of the aorta. Let's see what you did. You said also that it was abnormal, and well, in actual fact, the majority of you thought of a pulmonary valve stenosis, whereas the pulmonary artery was very, very well developed. But 30% had it right and thought that this was a coarctation. Coarctation is a very difficult diagnosis, and because sometimes it's only very late in pregnancy that that it becomes obvious that the left ventricle gets smaller and that the aorta also gets smaller. Also because of the smallest part is at the isthmus of the aorta, and it requires quite a lot of expertise to be able to show the isthmus, and there have been a lot of in the literature a lot of methods developed to predict the development of a coarctation, because sometimes during the fetal life is still okay, but it's especially after the birth when the ductus closes that the coarctation could give some severe problems. And so it's quite of a challenging diagnosis. And what we do when we suspect a coarctation, we ask the lady to deliver in our hospital so that we can check immediately. We can monitor the closure of the duct and therefore see whether the coarctation is developing or not. Because there are cases where it's not developing. We just think that it's a coarctation, but it was a false positive diagnosis. So it's still quite of a tricky chapter in fetal medicine.